items before it started. All participants were muted upon entry. However, I would err on the side of caution and suggest that you mute your line as well. If there are any of you that still do not have sound, if you want to drop a note in the chat box, it could be something, depending on what you're using as your audio source, and we can help you with that. Should be seeing today's presentation PowerPoint on your screen. Just a reminder, you have the ability to control that on your screen as far as size using tools on the top right of your screen. Also, have questions, today's content. If you'll put those in the Q&A box, we'll be capturing those questions and providing responses to those in a technical assistance guidance document. If you have questions about technical aspects, sound, or things like that, please communicate those through the chat box. We will be sending out a recording of this webinar along with the PowerPoint, technical assistance and guidance document, and some participation data from the event. So going out via division email blast. If you're not to receive those email blasts, you can go to the DD website, and you will see on the homepage on the right side of the screen, there's a yellow rectangle button that says Get Email Updates, and you can sign up for those there. So I believe that's all the housekeeping items that we have. If there's anything else that comes up along the way, as I mentioned, please feel free to communicate that in the chat box. So now we'll turn it over to today's presenter, Dr. Clay Stearns, Director of Assessment, Eligibility, and Utilization.
Case management training. The intent of this webinar is to explain upcoming changes to case management in the Division of Developmental Disability System, including what is changed, what isn't changed, and the how and when of when these changes will occur. The disabilities and the agencies that are contracted to provide support coordination have been working in partnership to lay out these changes in case management, how they will see individuals who are Medicaid eligible and those who aren't Medicaid eligible, including supports that will be offered to the individuals not Medicaid eligible. Cover the following areas, explaining those individuals served and who's expected to serve them, the coordinator qualifications associated with this, the intake, planning, monitoring, and system for case management. The big regarding those individuals who are not currently receiving Medicaid services. As of the only requirement as far as service coordination for those individuals is that they receive a once-a-year contact of some sort from their support coordinator. It means that the type of the support coordinator provided to these individuals is quite varied, and the information that goes to those individuals is really based upon content of that conversation, the knowledge of the support coordinator, etc. The idea is that we will standardize this in a different manner, and we'll talk about how that works during the presentation. For new into the DD system, this flow illustrates how their support coordinator assignment will be determined. The first is whether or not the individual is, quote, in MoHealthNet. And that's a somewhat ambiguous term. Because of spin-down issues, it's no for sure whether an individual should be considered someone who can benefit from the traditional targeted case management or not. We're going to approach a pretty pragmatic way. They're going to be asked questions about whether or not they actually use Medicaid. There's no spin-down limit. So whether or not an individual, say, has a $100 or less spend down or a $250 or less spend down, the real point of determine if someone is, quote, in health net is whether they actually use any of their services. So if they services, they have no spend down or they fairly regularly meet spend down, then they're going to be referred to the regional office case management system or the TM agency contracted to provide case management for the location that the individual lives. If they aren't, then we're a simple question. Has the agency agreed to serve non-Medicaid individuals in all of the TCM agencies in the state, and that the vast majority are going to provide at least some level of service to individuals regardless of their Medicaid status. There are one of the counties that are going to provide this case management service. Then the referral will be made to that county TCM. If they're with the state or in one of the counties that decided that they can't provide TCM services to these individuals, then they're going to be referred to the Regional Office Information Specialist. This is a position newly defined, and even though they're referred to as Regional Office Information Specialist, they're really wide function. That is an information specialist who is housed in, say, St. Louis, may be speaking to someone in Albany. They need help. Will be sent out on a statewide basis rather than a regional basis, although, as discussed later, where a person lives can impact the particular information that they receive. The real purpose of the information specialist is to get people who currently aren't in a position to receive TCM in where they are in a position to receive case management or TCM. So, for example, if the individual that was referred to them at some point in the future is able to get Medicaid, then they'll be on to the target case management entity that's appropriate for their location. If an individual with autism is referred to the information specialist, and through the actions of the information specialist is ready to develop a plan for autism project, that person also would be handed over to the TCM agency or the Regional Office Support Coordination System. And for meds, it works the same way. So information specialists have two functions. One is to get good information out to the individuals with they are working, and this is to get them handed off to the appropriate TCM agency, whether state or regional office, when they're ready to receive those services. When we began development, we've asked the TCM agencies to help us understand who they want referred to them and who they don't. And again, the big sticking point with this was who we're going to consider able to be funded by Medicaid and who we are not. So we didn't particular spend down amount. It included any individual who is essentially receiving Mo Health services, including those who have large spend downs and might be moving in and out of services. Non-Medicaid folks are those whose TCM services can't be paid through Mo Health Net and history of not receiving Medicaid funded services. In the past, was found eligible for Division of Developmental Disability Services was expected to receive case management. Again, changed for those individuals who are not in Medicaid and who are not receiving a state-funded DD service. The vast majority of folks who are either in a waiver or DD service, whether Medicaid eligible or not, or who are eligible and not yet in a state-funded DD service or in a waiver, nothing's changed. They're still going to be served by all TCM and division support coordination. The only how the individuals who are not in Medicaid and who are not currently in a state-funded DD service will receive information and guidance about services that they may in the future become eligible for. Some examples. Maria is 3 years old. She has cerebral palsy. She doesn't have Medicaid. And she lives in a county that doesn't provide case management to those without Medicaid. She's been eligible for Division of Developmental Disability Services after application, and she's referred on to the Information Specialist System. Through this Specialist System, she's going to receive information targeted to her age, where she lives, and her diagnosis. One of the things that happens in the DD system is that we get regular updates on who is Medicaid eligible and who isn't Medicaid eligible. And let's say that 6 months later, a review of that system shows that this person is now Medicaid eligible. In this situation, the information specialist is going to contact Marie and also facilitate a warm handoff to the case management system at the TCM agency. So there will be regular checks about who is Medicaid eligible and who isn't. And when we get into a situation where we can hand it off to a TCM agency who's able to then bill for case management services, we'll do so. Here's an example. There's a 18-year-old named Adam who has an autism spectrum disorder and, again, Medicaid, and lives in one of those counties that doesn't provide case management to those without Medicaid. Again, has applied and been found eligible for the Developmental Disability Service and referred information specialist system. This individual family are going to receive information targeted to teenagers and who live in the particular county that lives in and have autism diagnosis. This is training regarding the Autism Project. So there might be an email with let's say about someone who is using the type of Autism Project service that's available in his location. At the bottom of the information that's sent out by the information specialist is going to be contact information that would let the family or an individual know how to get in touch with someone to have a conversation about where to go or whether or not they're for a particular service. And say that the parents then use the contact information that was on the bottom of that Autism Project to get a hold of the information specialist. That information specialist is then going to have a person-to-person contact, verify that the person understands and wants to pursue the Autism Project, and then going to transfer case management to the appropriate TCM agency. Here's a Sarah Sold has an intellectual disability and, again, no Medicaid and lives in one of those counties that doesn't provide case management to those without Medicaid. As was found eligible and referred to the information specialist, and again, she's going to receive information targeted to her age and location and diagnosis. So, for example, let's say that there'd be a life course training in a town close to hers. We would send out information to her. The family know how to sign up for the life course training and giving them information about what they can expect. The individual is in a situation where she might be eligible for the Missouri Children with Developmental Disability waiver. Also be getting information on that service. If the parents use that contact information that's at the bottom of the MoKids training to contact the information specialist, again, there'd be a person-to-person contact. And because the case development for Mo kids is not TCM, is not eligible to billed as TCM because the individual is not yet Medicaid eligible, that initial plan will be taken care of by the information specialist. One has been accepted into Mo kids and is therefore Medicaid eligible, and then for the TCM agency is able to bill for any case management services. The information will then hand off case management to the appropriate TCM agency. In the system, the information specialist is supervised locally by a regional office assistant director. State intern assessment lead will be the individual providing technical assistance and guidance for this position. The real benefits for this information specialist to the system are, one, that we can more actively promote Medicaid eligibility for those in DD. The demographic and other information that's available to us to identify folks who most likely could be eligible for Medicaid, and we can send them information and have discussions with them promoting Medicaid eligibility. We've looked at this in the past. We've seen that there's quite a number of young adults with developmental disabilities who are not receiving Medicaid. There could be several reasons for this, including the fact that individuals are eligible to use health insurance benefits up till age 26. And so it may be that for a lot of families, the benefit of applying for Medicaid. So one thing that the new system is going to do is explain why Medicaid is important in the DD system and really work to promote that Medicaid eligibility. It is the development of relevant information based on really these three factors. Again, what's the diagnosis? If it's autism, let's send them information related to autism. If it's another diagnosis and we have appropriate information, we can send it out to them as well. It's also that we will pay attention to where they're at and make sure that we connect them with local resources. Again, if there are new trainings that are going to be available in their area, that we target those individuals in that area and the surrounding areas and let them know what's coming up. Age going to be a factor. For example, earlier this month, we received notice from First Steps. They will extend eligibility for those individuals who are turning 3 between April and August of this year through so that there's smoother handoff between First Steps and what usually a school would be responsible for. So we would send that information out to individuals who have birthdays between those two data points and that they understand what's going on. So again, it could be important. Another point at which age could come into play is when individuals are transitioning from being a minor to being an adult. Information could be sent out on guardianship and alternatives to guardianship to individuals targeted at that age to help the families understand what their plan options are. And a third opportunity for focusing on age would be older individuals where perhaps estate planning or trusts would be information that would be more of interest to them. So this location and age are really going to be the primary ways in which we figure out what information to send what person. Bit is to more regularly manage the transition between those who aren't in case management and receiving information sharing and those who then can become eligible for targeted case management. So perhaps more consistent information related to the Autism Project, the Mo Kids waiver, or Medicaid eligibility. has been used to illustrate what things are billable as case management and what things aren't. So, the have very little difference. Individuals who are in Tier 1, those are people who are in Medicaid waivers. The case management services related to that are billable. They're billable as targeted case management based on the individual's current state plan services. Individuals who are Medicaid eligible and who are not yet participating in a waiver, those individuals also continue to be eligible for case management billing under the current TCM rate state plan services. Those individuals Tier 2, particularly those who are not Medicaid eligible, and not waiver, these who are receiving a state plan service, these are individuals who are receiving a general revenue funded service. So, individuals who are still on what we call Choices program, those individuals' case management as of today is not billable, but a new system will be billable directly to the Division of Developmental Disabilities. The details of that billing process have yet to be finalized, and so we won't be going into them on this, but the concept is that if a TCM agency is providing case management services to anyone in any kind of funded service, they will get reimbursed for that at some level. Where management is not billable would be those that we are calling Tier 4, and the individuals who are not eligible for any paid service, and they're Medicaid participant. No individual plan associated with that, and again, the information that they will get will be distributed according to the group identity. As we once expected of the planning process changes, individuals in the Medicaid waiver are expected to have all of the TCM associated with the home and community-based services that currently do. That includes all of the things that was put out in the ISP guide earlier. Those at the Tier 2 who are receiving general revenue funded services somewhat less intensive plan expected. If some autism project, for example, and is only receiving some funding for a day camp during the summer, it doesn't make sense that we expect all of the levels of detail that's associated with the standard ISP to be used individuals too. It still requires a UR process. It requires a income statement, a budget, that sort of thing, but not all of the expectations for HCBS would be required for those types of services. 3, the individuals who are Medicaid eligible again and who are not receiving any kind of funded service. There is a need for an individualized plan, however, even fewer expectations. Since there's no service identified, there's no need for a particular outstatement about a service that doesn't exist. We'll learn more about what is expected and what isn't expected in each tier as we move through this process. It was sent out earlier this year, modified to reflect these changes. So a requirement code was added to the ISP guide to indicate whether the subcategories apply to all plans, only funded general revenue plans, those a waiver only in a residential service. So as you can see, the A, F, W, and R are for what things are required. Next. This has an illustration. So at if you look at the fifth box, it tells things are mandatory for those receiving residential services. So the IA in those situations must document things that are not expected in other situations. For example, that the individual's resources were considered when given options for residential room and board, and explanation of what housing resources like vouchers and rental assistance options were explored. Residential services, again, are example of a young person who's receiving funds for a summer camp. There's no requirement that you include those details in that particular type of plan. This is an example of what would be seen in the ISP guide that's been added to it. Again, we have the codes on the side to let folks know what's expected to be incorporated in the plan and what does not. In conjunction with these changes as to what's expected in a plan and the funding source, there's been some changes in the qualifications of support coordinators. There's for the expectation for support coordinator qualification for individuals who are in Tier 1, those individuals receiving Medicaid waiver. So it's always applied in the past regarding education and the experience requirements. They still apply when new service goes into effect. Look at Tier 2. There's a difference based on whether or not the individual is Medicaid eligible or not. If it is Medicaid eligible, the state plan education requirements still apply, and the state plan experience requirements still apply. But if they're not Medicaid eligible and receiving GR-billed only services, then the state plan educational requirements still apply, but the plan experience requirements do not apply. This is going to provide an opportunity for support coordinators to gain the experience that they need in order to become case eligible for Medicaid billing. It's a stepping stone then for the service. In Tier 3, because those individuals would be billed as full TCM Medicaid billing, both state plan educational and experience requirements apply. Or, because not being billed, there's such a drastic difference in what is required of TCM agencies, there really are no requirements. Once a person is Medicaid eligible, the current requirements stay in place. One of the things been asked frequently is, how many people does this apply to? Down onto the bottom line, you can see that over 36,000 people in Missouri have been found eligible and are receiving some level of Division of Developmental Disability services. This will apply to is roughly 10% of that. You get that 3,631 number there on Tier 4. It would apply to those. It applies to a fairly small portion of the 2,725 individuals also associated on Tier 4, those individuals who are receiving private based target management. So really low percentage. And again, when we look at the information, quite a few of these individuals probably Medicaid eligible, even a nudge and given some assistance. And so we're hoping that that number will drop even further with some additional effort. Considered is whether or not there's a change in the monitoring. When we looked at it, there really is no change. Those individuals who are in a waiver will still require the same type of monitoring and documentation that before. And actually, those in Tiers 2 and 3 who are in PAC or the old JUSTICE program, there's also no change. And for the additional case management, the ones that the targeted case management contracted entities can or may not decide that they want to provide services for, there is no monitoring for DD. It's their local decision, and they use their local resources to fund that service. This walk is a summation of some of the things that we've talked about before. So in this, you can see the different individual is Medicaid eligible. The main of what is expected of case management for those folks. As you see listed out, the ISP content expectations for each one of these possibilities. Monitoring is no. The support and qualifications really only apply to those who are not Medicaid eligible and in Tier 2, but it does provide that stepping stone, that ability to 1 year of experience that they would need in order to provide case management to the individuals who are Medicaid eligible. And whether or not the case management activities are billable is explained in the final column. Any Medicaid eligible remains able to be billed for case management services at the current rate. Individuals who are not Medicaid eligible but are receiving a general revenue funded service will be able to have for their case management as well. And the individuals who are in Tier 4, not Medicaid and not Medicaid eligible, there is no case management associated with those individuals. It comes right to it. We want to make sure that everyone understands that the division continues to have the intent of serving all DD eligible individuals, regardless of whether they have Medicaid or they don't have Medicaid. Really, all that has changed in the new system is we're seeing how those who are not Medicaid eligible and who are not receiving a funded service get information, whether it is through a once-a-year contact of some sort by their support coordinator, as currently is the case, or whether they get some targeted information sent to them based on age, their disability, and some other factors that will come up into play. That's the primary difference. The other big difference is the fact currently an individual who is not Medicaid eligible but in a state-funded service, their management is performed with no reimbursement. On the new system, those individuals' will be able to be funded. Information through the website. We're going to obtain a listserv related to different types of individuals who might receive targeted and relevant information. We'll also include podcasts for general information and have a variety of topics that we will go through. Some of the topics include, again, alternatives to guardianship, opportunities in your area, explanations of what the where and GR services are available through DD, explanations why Medicaid is important in the DD system, some tips about perhaps strategies for dealing with maladaptive behavior, encouragement to maintain records, all different topics that might be relevant to an individual will be included in this information that gets sent out through the website and through podcasts. We'll also conduct further WebEx trainings for these individuals, both with information and for some specific topics identified as being relevant for their particular situation. The time. As you've been doing this for a while, this began in November of 2017. The next big thing that will happen is beginning on May 1st, as individuals come into DD, they start to be referred over to the information specialist system if they meet the qualifications, if they are not Medicaid eligible and they're not receiving a service. That will only occur in those situations where the local county has informed the division that they're not able to provide any kind of service for those folks, or situations where they were receiving, would have received division DD support coordination. So we'll start coming into the information specialist system in May. We'll work with them, try to work out bugs through May and June. At the end of June, any individual that's in that particular set and who is currently receiving services from DD will be moved over en masse to the information specialist system. So this process is going to take place over the next several months, really take place fully beginning in July of 2018. Anticipate that we'll run into hiccups now and again, but we're committed to trying to provide good quality service to every individual who receives Division of Developmental Disability services. Thanks for listening to this training. We anticipate that there's some questions that we'll address. You would you put questions into the chat box. We'll be collecting those, and we will issue a frequently asked questions document based on the questions that we've received.
Thank you for your patience as we worked with mic settings and things like that in the beginning. Do you have this event recorded? As I mentioned earlier, it will go out with the presentation, with technical assist documents. Also, just a reminder, upon the conclusion of this, there will be a survey that opens up in your window. It's brief, but we do appreciate your feedback. If you'll take just a few minutes to fill that out, we'd appreciate it. Thank you.